I'm Dr. Rajat Gupta, and today we are talking about double eyelid surgery. There's a question which is asked. Now, it's a very funny question, but it's asked many times in my messages and emails by patients. Asian blepharoplasty or double eyelid surgery be done for a Caucasian? Now, this means that I need to explain you what is double eyelid surgery or what is Asian blepharoplasty, because this question actually means you have not understood what is double eyelid surgery. So let's talk about Asian blepharoplasty or double eyelid surgery. Now, if you've seen people of oriental race or Southeast Asian people, they have a big upper eyelid or looking like a sagging upper eyelid, which gives them a visual impression of a small eyes. They do not form an eyelid fold as what I do or Caucasians. So a person who does not have an eye fold, who desires to get an eye fold made, this procedure is called as double eyelid surgery of Asian blepharoplasty. So the question asked is, can double eyelid surgery be performed on Caucasians? No, they do not need it because they already have an upper eye fold. The question other asked is, can double eyelid surgery be performed on white skin? Of course, it can be performed on white or black skin, any color of skin. It can be done on anyone who desires an upper eye fold and who does not have an eye fold. So it's not related to the color of skin, it's related to whether you have an upper eyelid fold or not. So let's talk about what this eye fold is and why does it form in some individual and why doesn't it form in some individual. So if you see the anatomy of an upper eyelid, there is a muscle called as levator palpebrae epineurosis or levator palpebrae superioris, LPS in short form. Now this LPS muscle, the work is to open the eyelids. So our eyelids are closed, open, close, open. This work, close, open, close, open. This work is done by LPS muscle. Now, if you notice, when our eyes are closed, there is no eyelid fold. This eyelid fold is formed only when we open the eyes. Why? Because a small thin layer of this LPS muscle, this muscle which is supposed to open the eyelid, a small thin layer of this muscle gets inserted into the skin. So when this muscle contracts to open the eyelid, when this acts, the layer of the skin where it attaches gets pulled in, gets sucked in, and hence the eyelid fold is formed. What this means is that people who do not have an upper eyelid fold, their muscle is not inserted into the skin. Of course, they open the eyelid, so they have an LPS muscle, but that muscle is not inserting onto the skin. So, hence, for an Asian blepharoplasty surgery or a double eyelid fold surgery, it's very simple surgery. We have to insert this muscle onto the skin of the patient. Apart from that, we also assess if they have excess upper eyelid fat, then we may remove some amount of fat. If they have excess skin, we may remove some excess skin. But we always suture the muscle to the skin, suture the LPS muscle to the skin so that the upper eyelid fold is formed. So Asian blepharoplasty involves three things. One is compulsory, two things depending on patient. One, stitching of LPS muscle to the skin. It's a must to be done in Asian blepharoplasty. Second, removal of fat if needed. Third, removal of skin if needed. So these are the three things which comprises of Asian blepharoplasty. Now whether the person is of dark color, light color, Asian blepharoplasty can be done for anyone. It can be done for a Caucasian. Yes, you mean to say a white color individual who does not have an eye fold? Yes, of course it can be done. But if someone has an eye fold, then there is no need for this surgery. So this was my attempt to explain you what is Asian blepharoplasty, who are the patients for Asian blepharoplasty, and what are the essential steps for this surgery. Now this surgery, patient comes in the morning, gets it done under local anesthesia and goes back home in the afternoon after a couple of hours. It's a daycare procedure. A very gratifying procedure because you see the result immediately. Of course, there will be some swelling and bruising around the eyelids, which settles down over a week or so. But it's very gratifying procedure and a permanent procedure if done properly, and patients are very happy. If you have any questions regarding upper blepharoplasty or lower blepharoplasty or specifically for Asian blepharoplasty, feel free to personal message us, email us, or maybe write in comments below this video, and I will be there to help you. All the best, take care, stay safe, bye bye.